A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with our supporting partner Apollo Hospitals, has taken an initiative to recognize National Doctors Day through our video series Know Your Doctor, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors Day, let us express our gratitude to these extraordinary individuals. So, let's get started with the introduction. I welcome Dr. Usha Bora, Senior Consultant, Obstetrics and Gynecology, Apollo Hospitals, Ahmedabad. Welcome, Dr. Usha.
Thank you very much. Thanks a lot.
I wish you a very happy Doctors Day.
Thanks. And same to you. You're also a doctor, as I hear.
Thank you so much, Dr. Usha. So, to begin with the conversation, do you have any interesting stories or experiences from your medical career that have deeply influenced your perspective on patient care or the practice of medicine?
Yeah, well, I've been practicing obs and gynae for the last 35 years. And in these, I have so many experiences, but I'll quickly share three experiences. One is a extremely premature baby of a doctor. And fortunately, it's the birthday today. And the doctors themselves were in dilemma whether to continue with the pregnancy or not. But I pressed them hard, no, we should continue the pregnancy. And that baby is 5 years old today. And I'm so happy. And every year on the birthday, they send me a thanks note that because of you, we had this miracle baby. So that is one experience. The second experience was almost 13 years ago. A lady with 8 miscarriages, she came with the hope that she might have another baby, but a proper workup was needed for that. And I was very lucky and fortunate that I could give her a term healthy baby. So I'm very happy, and that deeply touch it. When you give happiness to somebody, you feel very happy that you have done something for them and you have done a lot, or they feel that I've done a lot for them. But was it a God's grace or whatever? And the third one is like there was a couple who had already done IVF treatment, but there was a they some of the investigations were missing. So I got the investigations did and treated them differently and without going through the cost. Like they already spent a lot on IVF, they had a baby after without an IVF. So sometimes you have to put your mind and brain together. You have to be well read. You have to have evidence based medicine. So when you're well read, things work out automatically and you get a lot of respect from the patients. So, but there are a lot of stories. So these are some stories which just came to my mind.
Yeah, happy birthday to that baby that you saved, the baby's life. And people call these miracles, but actually they are the hard work, your commitment, the doctor's commitment that actually saves a patient's life. So patients call it miracle, but it's actually your commitment and your
Um,
hard work and your diligent workup that you do for patient that saves their life. So hats off to you, Dr. Rusha,
Thanks
for
a
doing
lot.
that. So, are there any particular medical advancements or technologies that you find intriguing or believe will have a very significant impact on the future of healthcare?
Lot of in the last 30 years, lot of advancements have been done. Initially, when I started as a gynae surgeon, we used to make big incisions on the patient's tummy. But nowadays, we do minimally invasive surgery, which is a very good advancement. And on the top of that, now robotic surgery has come up in a big way, where the skills are quite, advanced, and patients they have huge advantage. They go home early, there's no blood loss, the anatomy is so clear, the pain, post-operative pain is so less. So that is one advance. The other one is telemedicine. Like if I'm sitting here and if there is a complication in a rural area in India, I can easily advise the doctor there how to manage, because in rural area there are not very well experienced doctors. So telemedicine is also a very big advantage. Then online consultations during the COVID area, it was very difficult for the patients to go to the hospital. And there came up online appointment system, and nowadays a lot of patients they take online appointment, and we can advise them online. So that is also, and then artificial intelligence is coming up in a big way, where patients they feed their symptoms, and then even the doctors they get the diagnosis. We can easily kind of order them investigations. So they're huge, then laser therapy in various kind of for various treatment. So these are advantages, and these are going to take the old, you know, form of medicine. So the younger doctors, they will have a huge advantage of these newer technologies in diagnostics
Yes.
and
Right, both the diagnostic and the treatment part is getting advanced in healthcare, current healthcare scenario. Telemedicine is one that you have talked about. Robotics is one that you have talked about, and the incisions that you have talked about. I think there is a lot to go.
laparoscopy. Yeah. Can you
Yes,
see me
and
properly?
yes. There is some. I think there is some network issue. Now
Yeah.
I am
Yeah.
able to see you. Yes.
Okay.
So the last question for this conversation is, what is that message that you would like to give to your fellow doctors apart from the professional front, on a personal note, you
See,
like to
on a
give?
personal note, fellow doctors are as old as I am, so I'm nobody to kind of advise them. But to the younger generation, I would advise that you should be well read. It's just not ki chalta hai kinds. You should read properly. You should be at par with the latest advancements. And most important of all is listen to the patient carefully. By taking a history, lot of wise doctors have told that by listening to the patient carefully, you can make 80% of the diagnosis. And then empathy and compassion is always there. Whenever you have empathy and compassion with the patient, half of the symptoms the patient says, आपके मिलने से ही मेरी आधी बीमारी ठीक हो गई. I've seen many a times, patients they make these comments, and you said, "Oh, what did I do? I just spoke to you very nicely, and I listened to you." So, this is the advice, that be empathetic, be compassionate, and keep yourself updated with the latest advancement technology and the literature of medicine.
Yes, you have very rightly, sent a message across that sometimes it's not just the physical symptoms that you take care of. There is the emotional aspect of any disease, for that matter, the psychological aspect of any disease
Yeah,
that can help the
psychology
patient.
plays a huge role. Yeah,
Right. So, with this, I would like to end this conversation here. It was very nice talking to you, and I would
same
like to
here.
thank you and all the doctors who selflessly serves our nation's health. And together, I salute your dedication, compassion, and unwavering commitment to our health. Thank you so
Thank
much,
you.
Dr.
Thank
Usha.
you very much.
Thank
Thank
you.
you.